that we will be crossing our borders. Let's now head to Burundi, which is still struggling to contain an outbreak of the deadly Mpox virus, a month after it was declared an emergency in the region. Authorities are grappling to manage the virus, but lack of adequate resources is hampering the fight. But as Isaac Wafula now tells us, there is hope as various stakeholders pull together.
Burundi has reported nearly 600 cases of the Mpox virus, second only to the Democratic Republic of Congo. But outbreaks are confined to a limited area and no deaths have been reported. Authorities in the East African nation have outlined measures to curb the outbreak.
Children in Burundi are bearing the brunt of the Mpox outbreak with alarming rates of infection and health impacts. Of the nearly 600 reported cases, 2/3 are children under 19 years old. And the situation is escalating really rapidly, with more than 40% increase in cases over the last 3 weeks.
One of the factors will be the ability to fight stigma by raising awareness of the disease, according to Gwakum.
I don't know if you've seen a picture of a patient with Mpox. It's scary. It's scary sometimes even after treatment. You are having long-term complications with scars. That's number one, and people don't want to have scars on their faces. Number two, the mode of transmission, not all of it, but there is a sexual connotation in transmission, and sex in Africa is not something that is spoken of on a daily basis. And if they think you are having a sexually transmitted disease, it stigmatizes you as well in terms of integration in your society.
No deaths have been reported so far, and availability of enough resources will be key in eradicating the virus.
We have not had any case of deaths. We have an opportunity to end this outbreak in a very short time period because the geographical area is kind of limited, and with concerted effort from all partners, I think we can limit the spread, we can contain the virus, and we can stop the outbreak without any loss of life. I think if we have all the resources in terms of doing the key intervention, number one, risk communication and community engagement, accompanied by an enabling environment where these populations, they are having the right tools in terms of infection and prevention controls, tools and supplies. I think we can stop it very quickly, but I don't think I want to give you a date, but I just think this can be stopped within a very few weeks.
Gwakum says about 2/3 of those affected so far in Burundi are children, and UNICEF is working to revive COVID-19 era remote learning to plan for children to continue learning from hospital or homes. Nevertheless, UNICEF has appealed for nearly $60 million to fight the virus in Burundi and 5 other countries.